It appears that even in the context of as powerful and effective regimen as KRD, transplant adds additional value and improves efficacy, which we measure by surrogate endpoints. For example, at the end of 8 cycles, total 8 cycles in both studies, with or without transplant, stringent CR rate in original study without transplant was 30%, now is 68%. And that even further improves down the road of the treatment with transplant, showing what we have seen also with some other studies like RVD with or without transplant, that the transplant is still valid even in the context of most effective regimens. So that's number one. Number two, our results have this time brought very mature and seasoned update from the earlier study without transplant, and what we see is close to amazing, I think, and clearly we conclude with all reservation of cross-study comparison, probably the best results we've seen in newly diagnosed myeloma at actual 4 years follow-up. 4-year progression-free survival is 69% in patients treated with KRD for extended treatment. That projection for 4 years in the current study is too early to measure, but at 2-year and close to 2-year follow-up, the curve with transplant clearly tracks up, and we anticipate it will be even better than without transplant. So it will be not only high rate of stringent responses, but potentially at least in this study, high rate of PFS. It's less appropriate to compare PFS, but it is what we see so far.